it's Joanne from Plymouth Medical. Thanks for joining us for one more Consumer Reports on comparisons of commercially available PRP kits. I'm here today at New Jersey Regenerative in Cedar Knolls, New Jersey, Dr. Malanga and Dr. Bowen's group. And we're running some side-by-side samples of the new EmCyte Supraphysiologic or SP 60 ml PurePRP kit. We're also going to be running a comparison to sort of the legacy PurePRP 60 ml kit to see whether there are any differences in the process. We'll be demonstrating that as well today. And then comparing both those kits to the new kit from Apex Biologics, the Xcell PRP kit, which takes more or less the same amount of anticoagulant, maybe 1 ml more of anticoagulant with 53 mLs of anticoagulated blood, and show you that process as well. What's cool about this side-by-side analysis is that we're actually going to be quality controlling the samples, the baseline blood, which we've taken from one patient. So taken one patient's blood, 180 mLs of blood, and processing a baseline CBC analysis with our 3-part diff Hariba hematology or hemocytometer. And then we're also going to be processing the 3 kits and running those 3 PRP samples through the hematology analyzer. So we'll be providing you with an exact comparison side by side from one patient. So I've just been given the baseline sample report here. So we actually took this baseline sample from a male patient aged 20. And we'll be showing the results obviously on the screen, but baseline platelet values are 247,000 platelets per microliter. So we've got Rachel here from New Jersey Regenerative, who's actually going to be processing the new SP PurePRP Supraphysiologic 60 ml kit for the first time. So we've just basically gone through our step-by-step IFU, which you'll be able to find at plymouthmedical.com under the resource section. You're also going to be able to see a video on the processing of this, but this is just a nice live video of how it's done. So we've taken 6 mLs of anticoagulant sodium citrate that's provided in our kits, and basically taken 54 mLs of whole blood for a total of 60 mLs of anticoagulated blood from one patient. Rachel is now top loading the anticoagulated blood in our device. I think the recommendation here is just to purge the air halfway through. So see how much air you've got there? You're going to basically just purge it back into the syringe by pulling back. To get like a nice airtight seal. There we go. And so you're going to basically fully load the new SP 60 ml kit with the anticoagulated blood. And just as you would with our normal double spin process, you're going to, the option to purge this sort of line here is available to you as well. So purging this tube will effectively remove all of the residual blood that collects into this sort of tubing here, so that once the blood is spun, you're not aspirating this whole blood in your final in your platelet suspension, as it were, once you've completed the first spin. So you'll see here, Rachel has basically loaded 1.5 mLs of anticoagulant sodium citrate and is now counterbalancing. All right, so we're going to be trying to sort of draw some comparisons from the new Supraphysiologic SP 60 ml kit to our PurePRP kit, which most of you have come across in the past. So effectively what the SP kit has done is combine these 2 tubes into one. So think of it as a sort of combination of these 2 kits into one. So we're going to be processing the PurePRP kit alongside the SP kit today to draw comparisons on the two processes, so you can see exactly what you're doing in every step. So just as we've done with the top loading of anticoagulated 60 ml of anticoagulated blood in the SP kit, Rachel's going to be top loading the same exact makeup of blood. So we took 6 mLs of anticoagulant sodium citrate in our syringe, went and drew 54 mLs of whole blood for a total of 60 mLs of anticoagulated blood. And Rachel is now top loading that in our first spin tube. She's also going to be purging the line, just as we done with the SP kit, to draw the difference, and also to ensure that there is no residual whole blood in the tubing here, so that it doesn't get aspirated back, so to speak, in the platelet suspension that's going to be aspirated once it's spun for the same amount of time, again at 1.5 minutes at 3,800 RPMs. All right, so the SP kit is completed its first spin at 1.5 minutes at 3,800 RPMs. So basically, you'll see the two phases as you normally would in EmCyte PurePRP process. So what Rachel's going to do here is she's going to basically aspirate the platelet suspension until she gets a red flash in the tube. So what we're doing here is, by spinning the blood for a short amount of time at 3,800 RPMs, we're basically ensuring that the platelets remain in suspension in the plasma without pushing them down all the way to the red cell layer and creating a buffy coat in the middle of the kit. So what Rachel's done now is she's basically aspirated all of the platelets out, and she's left behind neutrophils and all of the red blood cells. So the next step here in our new SP, or supraphysiologic protocol, will be for Rachel to bottom load that platelet suspension. So whereas we would have, loaded this platelet suspension in the second spin tube that looks like this in our old process, we're now basically bottom loading it directly into the same exact tube. And what this does is that it obviously reduces the amount of plastic that we're using in our process that's all closed. So it's a closed system still, using self-sealing ports. But what it also does is it really sort of eliminates the counterbalancing multiple times. So we're going to be basically processing the same exact weight, because we're just taking the plasma or the platelet suspension from the top and then basically bottom loading it. An important step not to miss here is to, again, recap the bottom of the tube so that nothing is leaked. So as we were sort of processing, we basically just finished processing the same exact process with our PurePRP process. So Rachel will be, again, aspirating the platelet suspension from the top until she sees a red flash, just as she would in the first SP kit. And then she will basically load that platelet suspension in our second spin tube. So as the SP second spin is underway, Rachel's going to basically, again, grab the platelet suspension from the first spin tube. Again, this has spun for 1.5 minutes at 3,800 RPMs, basically enabling the blood to separate and stratify effectively based on the cellular density of the blood components. So red cells go to the bottom, platelets remain in suspension, neutrophils remain at the interface right below the red cell layer. So what Rachel's done here is she's basically really taking all of the platelets out, all the monocytes, all the lymphocytes, or the agranulocytes that remain in suspension with plasma and has effectively removed all the neutrophils and the red blood cells from what we're going to then further concentrate. So we're going to counterbalance this. Basically, this counterbalancing step that Rachel is doing at the moment would be eliminated with our new SP kit, in that the SP kit basically has 2 chambers in it, and will basically, both of the spins occur in one tube. So in that sense, the counterbalancing is eliminated. Because, regardless of your patient's hematocrit, you're always going to have the same weight, the first spin to the second spin. Whereas in this case, obviously, a patient's hematocrit will differ from patient to patient, so there's always some adjustments to be made to the counterbalancing of our second spin tube, depending on whether we've treated male or female patients prior to this patient, and whether they've been on testosterone replacement therapy, which also affects and increases hematocrit levels. So in that sense, the new SP kit really sort of eliminates that second counterbalancing step altogether. So we've completed the second spin on both kits now. So you can see that the platelet buffy coat is created at the bottom of the second chamber of our new supraphysiologic PRP kit. And again, this platelet buffy coat is created at the bottom of our second spin device. So we have more or less the same crit, because it's coming from the same patient. So the same amount of plasma is going to be created supernatant to the platelet buffy coat. So I wanted to show you the difference and what we're going to be doing now. So Rachel is going to grab the SP kit. She's going to take the cap off the bottom and effectively remove the platelet poor plasma that she doesn't want to re-inject in the patient. So in other words, she's going to grab the platelet poor plasma and basically aspirate that down to 7 mLs, because our suggested process for this kit is to create 7 mLs of PRP. We're going to be testing that PRP to establish a dose of platelets as well. So at this point, she's going to aspirate the platelet poor plasma that's supernatant to the platelet buffy coat until she gets down to 7 mLs of plasma. If she was treating a smaller joint or a spinal application, she could basically aspirate more plasma and effectively get that down to 3 mLs of injectate if she wanted to. This would definitely concentrate the PRP further and almost double the X factor, if you will. But the total dose of deliverable platelets would be effectively the same, if you know what I mean. So at this point, Rachel is going to be resuspending the platelet buffy coat, and we're going to take out the 7 mLs and take some for testing. So we'll do our analysis based on this exact volume of 7 mLs of PRP, and actually just over 7. Is that? No, actually it's right on the line. So 7 mLs of pure PRP has been created here, and we're just about to test that now in the Hariba 3-part diff hematology analyzer. So all it needs is a half an ml. The device actually takes 10 microliter sample, and in a minute we're going to get those results. While we do that, we're going to also aspirate the platelet suspension, or the platelet poor plasma from our second spin device. Effectively doing the same thing as we've done with the new SP kit, but this obviously having a port that's at the top of the device and not at the bottom. And there we go. We've got 4.5 mLs of PRP created from the samples. So we're going to run that as we speak. So we should have the results from the SP PRP kit. So again, the baseline platelet values for whole blood were 247,000 platelets per microliter, and we've got from 7 mLs of PRP, 1.6 million platelets per microliter. If we wanted to calculate the total dose of platelets delivered, we would basically effectively take 1,683,000 platelets per microliter and multiply that by the 7 mLs. So we've got 11.7 billion platelets delivered in this sample, so very, very high dose of PRP. Obviously, much more concentrated because we had 4.5 mLs here, but we have 2.3 million platelets per microliter. So 2,391 divided by a baseline of 247,000 platelets per microliter. So at an X factor of 9.7 times baseline there. Again, the beauty of our double spin process is you are able to super concentrate platelets well above the sort of like 14x by just aspirating more of the supernatant platelet poor plasma. So in this case, we created 4.5 mLs of PRP. We could have aspirated it down to 2 mLs of supernatant platelet poor plasma and resuspended all of those platelets in a smaller volume of plasma, and that effectively creates a PRP that's super concentrated, same amount of platelet dose delivered, but over a much smaller volume of plasma. So stay tuned for the calculations, and thank you for your attention and the differences between the new EmCyte supraphysiologic PurePRP to our second generation PurePRP Protocol A. So we're actually back with Cedric. Cedric is at numerous goes at processing the Apex Biologics Xcell PRP kit, which is manufactured in Korea and assembled in the US by Integra Pain Management. Cedric's actually been trained on the process. I'm not going to touch it. We're going to use the same blood that we had today with processing our new SP PRP kit and our PurePRP 2 kits. So we're going to do a sort of a like-for-like comparison, which to our understanding has not been done before. In fact, we've heard a lot of anecdotal information from people saying that they have tested it side by side, but I think this is the first sort of public video on the comparison of our kits using the same baseline blood. So I'll leave it up to Cedric now to take you through the steps in the processing of the Xcell PRP kit.
So the first step is you have this little 45-degree bent tube that you attach to the end of the syringe that you drew your blood into. And you just need to attach this bent tube onto the syringe. And then you just put this into the top of the collection device, and you transfer the blood into the device.
So there's no port per se, it's an open tube system, basically.
Yeah.
Okay. So you've taken 7 mLs of the sodium citrate anticoagulant and 53 mLs of whole blood for a total of 60 mLs.
Yep.
In this kit, okay. So obviously, being that this is an open kit, it doesn't have like needleless self-sealing ports. It's an open system. I guess it's advisable to do this under a laminar flow hood here. We're actually not going to be re-injecting a patient with it. But given that it's completely open, food for thought to ensure that maybe this is processed under a hood.
Yeah, under a hood. So there's a little white cap that you can put on, and you can put it over the end of the tube. Now I'm just gonna weigh it so I can counterbalance it. So now we set it for 3,800 RPM and for 10 minutes.
So Cedric, this is a single spin kit then?
Yeah, it's a single spin kit.
Okay. So basically what's going to happen is you're going to effectively stratify all the cellular components of the blood based on their density. Or with fully swinging buckets, this occurs at 10 minutes. You're going to basically create a buffy coat right in the center of the tube. So that's how it differs really from our double spin process. Obviously, for those of you that have worked with EmCyte in the past, you are aware of the fact that we have single spin kits as well. So yes, I'm really looking forward to see what kind of results we're getting, because again, the marketing from this company, Apex Biologics, that are also in the business of amniotic fluid and exosomes, is basically stating that their Xcell PRP kits provide the same amount of platelet yields and the same amount of purity than EmCyte does. So we'll put that. We'll put those comments to test today. All right, so the 10-minute spin has now elapsed with the Xcell PRP kit that we're testing against EmCyte today. So take it away, Cedric.
Okay, so Apex Biologics provides this benchtop processing station that you can put the collecting device onto, so that when you aspirate the plasma and the PRP, it keeps the collecting device level. So first I'm just going to remove the white cap off the top, and then place the collection device into this tower, and then raise the device until it becomes flush with the top of the tower.
Should we show that maybe?
Yeah.
Let's see. So it's flush with the top of the tower. Okay.
Then take a 60 ml syringe and you place it onto the top. And then you aspirate until the buffy coat reads 6 ml.
Let me take a close up of this while you do that, just so we. So how many have you done of these, Cedric, so far?
I believe this would be the 4th kit.
Okay.
Tested now.
And as a group here at New Jersey Regenerative, you've been given a whole bunch of kits to test, I guess. And
yeah.
You've done more testing, right?
Yep.
Okay. And you have tested all of these? Oh, I see where you're doing it. So you're bringing the buffy coat right to 6 mLs?
Yep.
Okay.
And then after that, remove this. So this is the platelet for plasma that's been aspirated.
Yep.
And the kit has a 12 ml syringe.
Mm-hmm. Again, you're going to place it on the open port. Mm-hmm.
Yep. And now you just aspirate the PRP.
Oh, okay, so you're aspirating the 6 mLs of plasma that's above the platelet buffy coat that's created in this 10-minute spin, single spin kit. Okay. And when do you know to stop?
I usually do it until I see like a flash of red like that, and then.
A flash of red, okay.
Yep, and then I stop.
And what does the IFU call for specifically?
It just says to keep it and push until the remaining PRP captures the buffy coat.
Okay, so it's like a red flash, you know that you've got the buffy coat?
Yeah.
Okay. So you've got some red in there. Okay.
I'm just gonna mix it a little bit.
You're going to mix it for proper quantification with the Hariba hemocytometer. We've heard and we've seen some really interesting videos from physicians and the company themselves claiming that their platelet counts are similar, if not better, to EmCyte's pure double spin PRP, which is kind of intriguing to us because with a single spin kit, you know, you're really not yielding the same levels, or you're not really in control on the concentration of your PRP. So I'm really keen on finding out how this is going to turn out. So you've taken about like what, 0.5 mLs or 1 ml of the PRP?
About 0.5.
0.5 mLs of PRP in your hemocytometer, which you controlled, and it's the same device, same process as we've done with the SP, supraphysiologic PRP and the PurePRP.
Yep.
Okay.
And I guess before it was about 6 in total. Now that
6 ml.
Yeah.
Okay. Great. So we created 6 mLs of PRP using the Xcell system with their benchtop processing station. You know what would be cool to see, to be honest with you, is the platelet concentration in the remainder of, you know, what's here, like right at the, so when you're creating a single spin PRP and creating a buffy coat, by spinning blood for 10 minutes, you're gonna create that buffy coat right in the middle of the kit. And basically, all of the platelets, all of the monocytes, the lymphocytes, the granulocytes, they basically will come and lay flat on the red cell layer, because the red cells actually act like a roadblock. So by grabbing that sort of red cell flush that you saw there, we're presuming that you got most of the PRP, but I'd like to see whether we could test just that sort of level and see, because I'm guessing a lot of those platelets will be below the red cell interface, and to create a PRP that is, you know, that has a good amount of platelets, you're going to want to grab a lot more red cells, just like you would in our single spin kits with EmCyte. So the hemocytometer has completed the findings.
Yep. Just, printing the results now.
Great.
Yeah.
I'm going to get my phone so we can do the calculation. All right. So these are the results that came through from Xcell PRP. So you want to read them out to me, please, Cedric, so I can do the calculations. So we do, how many platelets did we get?
763.
763, and the baseline levels was 247, right?
Yep.
So we're looking at 3x PRP using this system. So very much different to the PRP that was created with the double spin SP, supraphysiologic PRP with EmCyte's new system, and also very, very different PRP than our double spin GS60 Pure 2 Protocol A that was processed. Thank you so much for your attention, everyone, and any questions, obviously, let us know at Plymouth Medical, and we'll be happy to answer any of those questions that you may have.